Next at 6, an area hospital in hot water over staffing issues.
The state stepped in to check things out after an incident earlier this year when the ER at Edgerton Hospital was left unstaffed because of an emergency in a different department. News 3's Marc Lovicott has the story.
62 pages of abbreviations and jargon that might not make much sense to you and I, but in the medical world, it's big.
This is very serious.
This state report outlines a number of critical state and federal violations that happened a number of times earlier this year at Edgerton Hospital. The state started investigating after an anonymous complaint about what the hospital calls a rare incident on August 9th of this year.
One night we had 2 codes that went on simultaneously. We had a patient in our swing bed facility that was coding, and at the same time a member of the code team actually coded also.
Because of the 2 simultaneous emergencies that involved a patient and a nurse who weren't breathing, staff were pulled from the ER to help. That means no trained staff were left in the ER to monitor 2 patients.
When you have patients that have life-threatening incidents going on, you send your resources to those areas. The patients in the emergency department were stable.
Even so, it was a violation and shed light on other instances in which the hospital violated its own staffing policies.
In the emergency room, having the appropriately trained staff available to treat, provide services to patients presenting with emergency care, that's very substantial.
The state says since this report and their visit, Edgerton Hospital has taken care of all of the violations. Hospital administrators say they're taking this very seriously, but vow no patients were ever in any danger because of staffing issues.
We are a much stronger organization now because of it, and we continue to work on the plan of correction and monitor it through performance improvement and quality assurance.
The report also went into some training issues with staff members at Edgerton Hospital. We were told, and the state's been told, they've all been corrected. In fact, a plan of correction was submitted to the state, and after a visit to check things out again, we're told everything has since been cleared.
And now what is next then?
Well, the state says because of the seriousness of the violations that were talked about in this report, this hospital will be more closely monitored. If there are more violations down the road, the state tells us they can and will consider taking away the hospital's license, in essence, shutting it down. For now, though, the hospital has been cleared and it's up to state and federal quality standards.
All right, Mark, thanks.
Sure.